Greetings. Today is April 29, 2020. I'm Dr. Julio Rodriguez from Brockett, Wisconsin. I'm proudly serve as your 88 9th District Trustee, and I'm really happy to be here today to address the group. My message to you today would be brief and would be mostly focused on some of the current initiatives that ADA has regarding the coronavirus. It was not very long ago that I was in Alchemist at a Board of Trustees meeting and joined the company of my good friends and colleagues from Michigan. And now, with the onset of the COVID-19 pandemic, everything has changed. The virus has impacted our lives, our health, our offices, income, staff, family life, and the way that we interact with each other. Since late 2019, COVID-19 has reached pandemic status with cases in 185 countries. Over 2.6 million individuals have been infected, and over 180,000 have died. In Michigan alone, as of today, according to CDC, 39,262 people have been infected. And as you know, Governor Whitmer has extended the stay-home order until May 15, mandating non-essential procedures to be postponed, and this includes dental procedures. From a national and global perspective, the pandemic has affected all of us in different ways and with a different degree of severity. The American Dental Association has shifted our resources to focus as to how we can help our members dentists cope with the challenges that this pandemic has brought forth to all of us. The COVID-19 pandemic has significant adverse impact on high contact industries, including dentistry. As a result of strict social distancing guidelines imposed by many states, dental clinics, general practice physician offices, optometry offices, as well as non-healthcare industries like hotels and restaurants have closed. To keep dentists and patients safe from adverse health effects of COVID-19 and to conserve personal protective equipment which was short on demand, the American Dental Association issued on March 16 guidance that dental practices postpone elective procedures and only provide emergency or urgent care. On April 1st, the ADA extended those guidelines to April 30th. The procedures that ADA recommended dentists to postpone included radiographs, oral examinations, aesthetic dental procedures, routine cleaning and preventive therapies, and orthodontic procedures that do not involve pain management. Urgent dental care included extensive dental caries involving pain, uncontrolled oral bleeding, facial trauma, dental trauma, tooth fractures, and biopsies of abnormal tissues. As soon as the epidemic was announced, the Board of Trustees started to meet via Zoom daily for the first 2 weeks, and 3 times a week after that, trying to evaluate the extent of the impact of the virus on our members. Our offices in Chicago were closed, and the personnel started to work from home, and still are doing that to this day. The ADA, guided by our president, Dr. Chad Kahani, Dr. Dan Clemenson, president-elect, Dr. Kathy Alofen, executive director, our board of trustees, ADA councils, and the entire staff have been working tirelessly and overtime to figure out the complexity of the situation created by the pandemic and to create interim policies to guide our members through the challenges, not only clinical, but economical, as well as problems in the social aspect. The ADA recognizes that local or state government decisions regarding closures, including restrictions about elective health care, supersede ADA's recommendations. In addition, local and state health departments, state dental societies, and in some cases, large urban local dental societies may better understand local disease transmission rates and conditions and make more informed recommendations regarding elective dental care availability. We are reminded often that the ADA is not a regulatory entity and we cannot make national health policies. And this is why we are working long hours to create interim guidelines to help our members succeed and be safe during this epidemic, always in communication with CDC, OSHA, and others, of course. We have lobbied strongly to Congress and the SBA through our Governmental Affairs Office in Washington in your behalf to gain easier access to the significant economic initiative passed by Congress, like Paycheck Protection Programs, the Economic Injury Disaster Loans, Employee Retention Tax Credit, etc. To this avail, the ADA has posted an article in Dental Practice Success with a step-by-step instructions how to do just that. This information is also posted in the a.org/virus page, the ADA Center for Professional Success, and other public publications. By the way, all this information that we have published has been stored in front of our firewall, and it is accessible by all members and non-members. As the states are reconsidering reopening, the ADA believes that dentists should exercise professional judgment and carefully consider the availability of appropriate PPEs to minimize risk of viral transmission. The ADA is communicating with the Federal Emergency Management Agency, FEMA, or the federal agencies and relevant organizations to advocate that dentists as essential healthcare workers are prioritized for PPEs. As many states are now contemplating returning to work, the newly appointed ADA Advisory Task Force on Dental Practice Recovery, co-chaired by Dr. Kurt Norwell from the 16th District, Trustee, and Dr. Rudy Lydell, Chair of the Council on Dental Practice, have worked extremely hard to produce and publish an interim mask and face shield guidelines for appropriate PPEs in algorithms, and has recently developed a toolkit to help dentists return to more normal practice operations while taking precautions to protect staff, patients, and themselves from COVID-19 as some states reopen. This was available to you all on Monday the 27th. Because areas of the country will return to practice at different times and under different circumstances, dentists will need to use their own professional judgment and consider COVID-19 cases in their area, the need of their patients, and the availability of necessary supplies as they begin to provide elective dental care again. Hopefully, adhering to the guidance of the Return to Work Interim Guidance Toolkit and Interim Mask and Face Shield Guidelines. This last set of documents highlights the characteristics of several common types of masks and the appropriate use. Also, this chart addresses mask fits, protocols, and usage limitations. Please consider that patients who are asymptomatic might still be COVID-19 infectious. It should be assumed that all patients can transmit the disease. Use the highest level of PPEs available when treating patients to reduce the risk of exposure. Some risk is inherent in all scenarios. If masks with either goggles or face shields are not available, please understand there is a higher risk for infection. Therefore, use your professional judgment related to treatment provided and the patient's risk factors. The Return to Work Interim Guidance Toolkit focuses on the short-term management of dental practices and includes a sample welcome back letter to patients, pre-appointment screening guidance, in-office patient registration procedures, reception area preparation strategies, a chairside checklist, staff protection strategies, and a supply shopping list. Our goal was to provide a basic roadmap for members to follow that would allow them to safely reopen their offices. I hope you have been monitoring the developments of the virus and taking advantage of all the resources at your disposal, whether it is by logging into ada.org/virus or through ADA News, Daily Morning Huddle, webinars, and other ways. For further information, please contact the MDA and follow their recommendations. I want to thank you all for your efforts to help with the solution to the challenges of the COVID-19 epidemic and for staying home safe. If and when you are officially cleared and ready to restart your elective procedures in your offices, please do it cautiously. Follow the Return to Work Interim Guidance Toolkit and interim mask and face shield guidelines recommendations. These are a very comprehensive, one-of-a-kind set of guidelines developed with you in mind. It was created for you so that you and your staff and patients should be better protected from the disease using your best professional judgment and the best information that professional knowledge and science can provide. Also, please be conscious of the state of anxiety that your team members and patients may have, and that they must feel comfortable that sensible precautions are being taken in the dental office for their safety and protection. I wish you the best in these trying times. Hope to see you in person once we return to normalcy. I am convinced that we will get through this together, and together we'll be stronger than before. Please be safe and feel free to reach out to me if you have any questions. I am always available. God bless, and thank you for listening.